So we have just one announcement today, and then we're going to hear from our epidemiology team about our respiratory updates. We're also going to be hearing from our community mental health and addiction team, as well as our clinical team talking about PrEP. And then, of course, we always save time at the end for a Q&A. If you have any questions, please direct them in the chats as we go during the presentation, or you can wait till the end. So, we have one announcement. Not, of course, always sign up for our monthly newsletter if you would like. But just to let you all know, our next school health update call will not be on January 1st due to the holiday and everybody being on winter break. So our next school health update call will be on January 8th, the following Wednesday after winter break is over. That being said, we're going to go ahead and move it over to epidemiology. Jake, are you on?
Hi, Chris. Yeah, I'm right here.
Take it away.
Good afternoon, everyone. My name is Jake Alexander. I'm the outbreak epidemiologist for Pima County. Chris, are you controlling the slides, or is there a way for me to do it?
Yes, I'm controlling the slides. Just go ahead and
Okay.
hit next.
Okay. Next slide, please. So today on our agenda, we'll talk about our normal respiratory updates, which include COVID-19, flu, and RSV. Then I will go over a brief flu outbreak guidance and some tips for dealing with and recognizing flu. And then we will go through a pertussis outbreak, which Sophia will walk you through. Next slide, please. So here we have our our RSV update for this meeting. As you can see, we are now moving into peak respiratory season. The RSV cases have been significantly lower this year than in previous years. In the current RSV season, we have only 20 confirmed cases, which is 93% less than usual. The majority of people who are affected by RSV are children from ages 1 to 4. It is a good thing, that we're not seeing a ton of this. Last year in particular was a pretty bad year. As you can see, the dotted line shows the 2023 to 2024 respiratory season counts, and the black bold line shows the 5-year average from 2019 to 2024. So in comparison to both the average and last year, we're doing much, much better. Next slide, please. Here we have our influenza update. As you can see, our case counts are actually higher than last year at this time, and last year was also over the 5-year average. So that's something that we're definitely going to want to keep an eye on. So in the current flu season, we've had 652 confirmed cases, which is 153% more than usual. The majority of cases are in the 19 to 49 age group, with a little less than half occurring in there. However, the second most affected age group is children from ages 5 to 18. We are
Hold
still
on. Hold on, Jake. We're getting thing chats saying that they cannot see the slides. Give me 1 second.
Yep, no problem.
Let's try. I apologize for this minor inconvenience. Can you all see the slides now? Okay, great. Oh, we're still not being able to see them. Okay. Let me go ahead and stop sharing. Okay. So I'm seeing here that it may be a monitor issue. If you can't see the slides, I would encourage you to try to leave the meeting and then come back and seeing if that will work, or yeah, going into your team settings. I apologize for that, Jake. Do you want to continue?
That's no problem. I could also wait a minute if we want.
Okay,
I can keep going. Doesn't. It's no big deal.
let's wait a minute for the folks who need to maybe step away and then come back.
Yeah, sure.
Okay, I see they have rejoined.
Hmm. All right. I'll keep going on then. So that's it for flu updates. We can go to the next slide, which will be our COVID-19 updates. So currently we are in, again, week 47 of the 24-25 respiratory season. Uh, in the current COVID season, we've had 3,151 confirmed cases, which is 76% less than usual. Again, you can compare the yellow bars to the dotted line. That'll show our current year versus the previous. And then the black bolded line will show the 5-year average. I'm actually not sure if everyone has seen this updated figure. The 5-year average uh, causes the y-axis on this figure to go up incredibly high, which makes it very difficult to actually see the differences in case counts for the most recent years because case counts have been so much lower than they were at the height of the pandemic. So what we did is basically squish down that 2,000 to 5,000 count part just to make it a little bit more easy to see changes on the weekly level. Just for clarification, if this figure were to be to scale, including everything up to 5,000, it would be about 3 times as tall as it is now. So that's just you know should make it a lot easier this way. Uh, so currently, people who are in the 19 to 44 age group are most affected by COVID-19, with about a third of all cases occurring there, with individuals 65 and older being the second most affected age group. And last week, we did have 515 confirmed cases, which is slightly more than the prior week, but still less than the previous year, which is always a good sign. Next slide, please. And our final slide just shows the case counts of those 3 respiratory viruses compared to each other. And this is just for the current respiratory season. So for flu, this week there were 167 cases, there were 5 RSV cases, and the 515 COVID cases that I mentioned previously. One thing that I do want to mention is that, especially post-Thanksgiving, you can, expect to see possible increases of each of these because, everyone was at Thanksgiving dinner, seeing family. There was a lot of travel. So it's just something to keep in mind. If you do notice any symptomatic individuals, I, as always, recommend to send them home until they are, feeling better. Next slide, please. So just a quick rundown of some information on influenza. So influenza, also known as the flu, is a contagious respiratory illness caused by the influenza virus, and it can cause anywhere from mild to severe illness and can at times lead to death. Its common symptoms include fever, cough, sore throat, running or stuffy nose, muscle or body aches, headaches, and fatigue. What's important is to recognize the ways that it's transmissible to other people. The main way is by droplets. So if you have one individual who's sick and they cough on somebody else, that is a good way to get the flu. However, you can also contract it via contact with surfaces that have the virus on it because of exposure to sick individuals. So if you have high contact surfaces in a classroom, such as doorknobs, desks, keyboards, anywhere around like a hand washing station, like those are all high contact areas. So you're going to want to make sure that they're wiped down and cleaned as much as possible. Effective prevention measures include encouraging vaccination among staff and students, encouraging proper hygiene, wiping down commonly touched surfaces, and as always, having sick individuals stay home. In the event of an outbreak, please notify the Pima County Health Department immediately. We can help you to increase awareness among parents and staff and provide all sorts of educational materials that can be useful, to send home to educate families, as well as give you ways to help uh, improve prevention measures around a school. And as far as communication goes, maintaining transparency with parents and staff is always important while also respecting privacy. Does anybody have any questions on the flu? And if not, I will pass it on. I believe Sophia's slides are now.
Hello, good afternoon, everyone. I'm Sophia, and I'm the vaccine preventable disease epidemiologist, and I'll be talking to you regarding about pertussis. Pertussis is a highly contagious respiratory disease caused by a bacteria called Bordetella pertussis. The symptoms include severe coughing fits, a whoop sound, or apnea. The cough can have people coughing up onto the point that they feel like throwing up, or they do throw up, or sometimes it can cause difficulty breathing. um Pertussis is spread via a respiratory droplet with the incubation period of 7 to 10 days, but it could be as low as 4 to 20 and all the way to 4 to 21 days. We highly encourage that to prevent pertussis, we highly encourage vaccination for DTaP or Tdap among students. The CDC recommend a 5-dose series of DTaP vaccine, which will be taken at age 2 months, 4 months, 6 months, 15 to 18 months, age 4 to 6, and they also recommend a booster of Tdap between every 10 years or at every pregnancy between the age between when the pregnancy is at 27 to 36 months 27 to 36 weeks. We also highly recommend that you monitor close contact, and then we would recommend that any close contact should consider prophylaxis, especially close contact that are considered high risk individual that are immunocompromised or their pregnant staff. In the terms of an outbreak, and an outbreak is more than three cases of pertussis in a specific setting, or they could be linked together. We highly recommend that you, even when you get one case of pertussis, we highly recommend that you notify the health department immediately. In the sense of an outbreak, we will work together with you to help you provide educational materials and help you communicate with parents if that's needed. We also highly recommend that you enhance cleaning of high touch surface areas and also encourage proper respiratory hygiene. And in terms of communication, we encourage that you maintain transparency with both parent and staff while respecting privacy. Any questions in regards to pertussis? All right, and I am done.
Okay, thank you. And I think epidemiology has also included slides for where to report communicable disease. You can click on the link on the slide. We'll also be sending out these slides at a later date. And these are additional resources that epidemiology provides from PCHD, the CDC, and the state as well. And of course, you can always contact epidemiology at epi@pima.gov, and there is the direct line at 520-724-7797, and then their fax. With that being said, our community mental health and addiction program is going to be presenting. Are they here with us?
Yes, I'm here.
Okay, go ahead. The floor is yours.
Hey everyone, I'm Van Qua. I'm the new health educator with the Community Mental Health and Addiction Division. You may have met my predecessor, Leah. You can go next slide. So, in our division, our team's mission is to provide education and awareness to most of the critical issues surrounding mental health, like suicide prevention and the drug overdose epidemic, and also end the stigma associated with mental health and addiction. So CMHA works towards this goal through 5 different arms of influence in the community. I'll start with mine. I work in the outreach, and here, this little mini team, we provide outreach in many forms, like through health education and providing appropriate resources to the community. We also provide harm reduction and overdose response education, as well as give out prevention resources like Narcan and fentanyl or xylazine testing kits. We also have an epidemiologist in our division who works directly with the Office of the Medical Examiner, and they complete overdose and suicide fatality reviews to provide updated data to our community, observe trends, and ensure that we're meeting the current needs of our community. And also in that same vein, revealing new contexts we didn't have before that can help us accomplish our mission. Like, for example, things that we thought were random can now maybe look like trends because we have the data there. Next slide, please. So here's just a brief overview of the work we do to address these needs. Like on the overdose response side, we have peer navigators and case managers who work directly with community members in hospitals, jail, residential. They use MedSys to track and report this information, but also using it to learn from other service agencies that also report the same information. We also distribute Narcan, also known as naloxone, and as I said before, fentanyl and xylazine testing kits, along with overdose prevention trainings and epidemiology, which I had just discussed. And outreach, we do that to make and maintain relationships with stakeholders, behavioral health organizations, various committees like this one, collaboration groups, and pretty much just disseminating that information that we've learned to people like yourselves and the greater Pima community. And in harm reduction, we've also launched multiple campaigns focusing on ending stigma for mental health and addiction. Next slide, please. So I just want to take a quick moment to highlight a program that our team provides, specifically me. In January, I'm going to be leading a cohort for the Strengthening Families program, which is an evidence-based family skills training program for both high-risk and general population families. And all this information also is recognized internationally. The cohort I'm leading in January is going to offer a virtual 11-week program for families with children ages 7 to 17. Next slide, please. So another little interview or brief description of what we're doing there. So each family is different. So we generally just review the general risk and protective factors that may or may not apply to the families there. And since these risk factors may not present similarly in others, oh, sorry, my bad. So the risk factors may not present similarly in others. So we like to use that as like collaborative space for families to understand how the nuance of how these risks are affecting them. And I did want to say also that these risk factors aren't a guarantee that the youth will end up using substances. It's just things to identify to help address later. But yeah, these are just some of the basic factors that SFP is beginning to address. Pretty much just to take a look at the various risk factors that may be affecting a family and learning about what protective factors that can help lower the risk of youth substance use, delinquency, and depression. Next slide, please. Again, another little brief overview. It looks a little tiny, but it says 10 lessons, but it's technically 11 with the introduction. So each lesson builds on the previous. We'd be meeting twice a week, and we give them time in between to practice and also just have activities I don't like to call it homework, but it's kind of homework technically, to reinforce the lesson. Not the binge watching model. We like to help them actually synthesize the information and become more intentional with that. We also have a check-in night to talk about what activities they did and didn't do, and also why. Like, what were the barriers there? Can they address them next time? And also, just to make it more accessible, we do supply all the materials necessary for participating and completing the program, which can be through email or also mail. You just need to show up. And even though the primary outcome is to improve family relations, it's really life skills we're teaching here. It's mostly about each family in the cohort and group learning from one another and sharing. And every lesson here has practical life skills that we want everyone to know in general, just to become well-rounded people and the people we want to live in our society, I guess. Next slide, please. So here's just a complete, or as of now at least, complete list of the presentations and trainings that we offer. So we offer a chronic pain self-management program, and as the name suggests, it's for adults experiencing chronic pain or caregivers for people that are experiencing chronic pain. And then mental health first aid for youth and adults, but that's specifically for people that work with youth and for adults that work with youth, and then adults that work with other adults. We also have a tailored program for our mental health first aid, specifically for the tribal communities and indigenous peoples, as well as we're adding another part of that to the curriculum, which is understanding ACEs, and that's understanding adverse childhood experiences. There you go. And Narcan training here. I'd like to think of it as harm reduction is pretty much like the 101 class, and overdose response is 102. There's a lot of overlap, but there is certain distinctions that we like to make them like the two separate bullet points. But as with everything that we do here, it's pretty connected to the other things like the fentanyl presentation, which I'll go over like right now, actually. And then these last four presentations are going to be the ones that I'm specifically working on, specializing in, which is suicide prevention training, and that's called QPR Gatekeeper. We have two fentanyl presentations, which is Rise of Fentanyl. That's the one for adults, and Fentanyl, A Killer Among Us, which is a more accessible one for youth. And then, as I mentioned earlier, the Strengthening Families program, as well as offering stress management presentations. So if anyone has any interest in us providing these trainings to them, or please check out the bit.ly CMHA-interest if you don't have a camera. But if you do have a camera, you can scan the QR code, and it'll take you directly to our Pima County page for trainings and interest, where you can fill out a form, and one of us will get back to you. And then the next slide is just if you want to also contact us directly. Oh my God, the V, it's bothering me. Yeah, contact any of us directly. Either way, someone will get back to you, whether you go through the official site or here. And you can also call the number that's on the left side of the screen. It'll take you to this like menu where you can also ask or get like Narcan training, request Narcan in general, just all this stuff that we're going to be offering. And I think that might be it, unless Liz has anything to add. No? Okay.
No, I don't think so. As Benqua mentioned, any one of our staff can help you out with getting some of these trainings, but we specifically are the ones that are going to schedule them and provide them. So yeah, give myself an email or a call. Kathleen and Heather are two of our new training and education coordinators. They're specifically working a lot on the mental health first aid and QPR. The youth mental health first aid for tribal communities and indigenous peoples. It has not yet started, but hopefully we will be offering that, I want to say early mid next year. And same thing with the understanding ACEs. That being said, if it's something that your organization is interested in, there are other people in the community who provide some of these, even the Strengthening Families program. We just do the virtual one, but I know that there are some in person. They're a little bit different for the age range. But yeah, we'd be happy to connect you with any of them. And then, yeah, as Ben Kwa mentioned, that 520-724-7470, that actually takes you to all of our team, and then you can select specifics. With all of the changes we have over here internally with the phone systems, however, I do highly recommend using emails, just as a side note. But I think that's it. Thank you so much, Christopher, for letting us kind of overview.
Of course, thank you so much for presenting. And of course, if anyone has any questions, you can put them in the chat now or wait till the end. Thank you, Van Qua, and thank you, Liz. We're going to go ahead and move over to our clinical team. Is our clinical team here?
Good afternoon, everybody. My name is Neil Bonsack. I'm a nurse practitioner here with the clinical services in the health department. Before we get started, I just wanted you all to be aware of some of the services that we do provide here in the health department. I've been in Tucson for about 25 years, and I wasn't even aware of all the services that the health department provides. First, we provide reproductive services for women age 14 through menopause. Those reproductive services can include combined oral contraception, so the pill. We also have Depo-Provera, which is a shot. We have an implant, and we also have intrauterine devices that we will place in the clinics and also on our mobile van. We provide well women's services where we do breast exams and do PAPs for women. We provide STI screening and treatment here in the clinic through the nurse practitioners. We are also doing medicated assisted treatment where we will help individuals that want to free themselves from addiction and provide Suboxone for them and then link them to services. And then finally, what we're going to talk about here today is we provide PrEP and PEP services. What is unusual about PrEP, we've been providing this for adults since 2022, is we had not been providing it for youth. So let's go ahead and next slide, please. Okay, what is PrEP? PrEP is pre-exposure prophylaxis. Okay, we're trying to prevent individuals from contracting HIV if they're exposed. It's a daily pill. The blue pill is pretty accurate as to what it looks like. It's called Truvada, and that is the medication we'll be using. There is other oral medication out there, Descovy. We've been using a lot of here in the clinic, but because we're linking individuals to services and the person that we're linking to is going to be using Truvada, that is what we are going to use. It is 99% effective when it's taken daily as directed. And that is the one thing that a lot of individuals may not like is that they have to take something daily. There is an injectable version. I don't know that if that's being offered at El Rio or SAFE at this point in time. Well, I actually do know that it is being offered, but for adults only at this point in time. All right, next slide, please. Okay, why PrEP for youth? How did we get here? So we got here because earlier this year, I was in clinic running through the day, and the lab person was at the end of the hallway, and they were waving their arms frantically, trying to get my attention just as I was going in to see a 17-year-old. I was going in to see the 17-year-old to start him on PrEP. Mind you, we weren't providing that service at this point in time. So I went and talked to the lab person, and sure enough, the kid had HIV. Sorry, this is dear to me. One youth is just one too many. And individuals between the ages of 13 and 24 represent 19% of the cases that are newly diagnosed, and between the ages of 13 and 34 are 56% of the new HIV diagnosis. It is also important to recognize that half of these individuals are unaware that they are HIV positive, and where that translates to for Pima County is that in 2022 and 2023, we had about 8 kids that were HIV positive. Next slide, please. Who is eligible for PrEP? Everybody's eligible for PrEP. PrEP works for women, men, young people, transgender and non-binary people, people of all gender identities, sexual orientation, and individuals who inject drugs. For PrEP for youth, you must be at least 14 years of age. Mind you, our minimum cutoff age is 15. They must be HIV negative, and they must weigh at least 77 pounds. Those that we consider at highest risk are, of course, men who have sex with men, multiple partners, partners with unknown HIV status, drug use, homelessness, and previously sexually transmitted infections such as chlamydia or gonorrhea. Next slide, please. Where can you get PrEP? So you can get it through our two brick and mortar. One is on the North Clinic on 3550 North First Avenue, and also the Teresa Lee Clinic, which is a little bit more hidden off of Valencia and West Commerce Court. We also have mobile clinic, and we're providing mobile services. We do go out to high schools to provide services, reproductive screenings, and now we'll provide PrEP as well on the mobile service van. El Rio is also providing PrEP for use, and they started this year as well, and their cutoff age range is 15 as well. Next slide, please. How do I get PrEP? So you must be seen in one of the clinics or on the mobile van. When you come in to see us, you will see a provider. Labs will be drawn. We've screened individuals for chlamydia, gonorrhea, HIV, hepatitis, and then we do a rapid screen for HIV and syphilis to make sure that individuals don't have HIV before they're drawn. I still can't tell you if there's going to be an informed consent at this point. When we submitted this for approval by legal and management, I include an informed consent so that teens are aware of what they're signing in for. PrEP will be given to the client. At this point in time, I don't know if that is going to be 28 days. There is talk of possibly giving individuals a 2-month supply for them to take. And then the client is linked to follow-up services at our sister agency, El Rio. Next slide, please. Good question. Do teens need consent? Because Pima County operates under Title 10, we do not have to have parental consent for individuals to start on PrEP or to get other services. They can get those services without their parents' permission. Also, it's important to note that we do not bill individuals for these services. For services, if you're an adult, let me clarify that. For services, when you're an adult, we will bill your insurance if you have insurance. If there is a copay and individuals are unable to pay for that copay, we don't come after them for collection, and we don't report to a collection agency. We ask for a donation. If you can give a donation, great. If you can't, that's fine as well. What happens is that money gets put into a little note and it just sits there. But we don't ever try and collect on it. So individuals that don't have access to insurance or don't want their parents to know that they're seeking these services by using insurance, we don't bill the insurance and individuals don't know. And so, yes, we can treat individuals without the parental consent. Okay. One of the things that I'd like to talk about just real quick is that PrEP does not protect against all sexually transmitted infections. Okay. In this last year, we have found that there is a new service out there called PEP, and this is pre-exposure or post-exposure prophylaxis. And what this is we use 2 capsules of doxycycline within 24 to 72 hours of unprotected sex. This significantly reduces the chances of an individual coming or contacting or contracting chlamydia, but it also significantly reduces the chances, it reduces the chances of getting gonorrhea and syphilis as well. And that's been pretty popular lately and has been taking off. And I think that's it for me.
Thank you so much, Neil. I appreciate that, and thank you for sharing. So, with that being said, do we have any questions, either for our community health and addiction program, our clinical program, or our epidemiology program? And if so, you can go ahead and put those in the chat. Okay, seeing none. Of course, you can always contact us at our school support line at 520-724-7018, or you can email us at schoolsupport@pima.gov. And just like what Liz said, right now, today, our phone lines are being updated to a different system. So if you need to reach out to us within this next week or two, definitely email, but do not hesitate to reach out by phone.
Was the question in regards to parental consent for PrEP?
Yes.
Okay, so no, we because Pima County operates under what's called Title 10. It's a governmentally federal provided program. We're able to provide those services without parental consent.
That's amazing. Thank you so much.
Yes, you're welcome.
Okay. Any other questions?
Actually, related, my bad. Want to ask the same question, but for PEP instead, post-exposure prophylaxis. If a teen thinks they might have been exposed to HIV or something, do they need it there?
We have not encountered that yet, fortunately. But I don't want to misstep or misrepresent because it's an excellent question. We haven't crossed that bridge yet. My initial belief would be that it would be considered more of an emergency, and we would have to seek medical director's approval to start somebody on a post-exposure prophylaxis if they thought they'd been exposed to HIV. My inclination is to say that we would do it, but if not, somebody would be linked to services either at El Rio or at the Peterson Clinic as rapidly as possible. Time frame for post-exposure is 72 hours. Individuals have to come in within 72 hours of their supposed exposure in order to start what's called post-exposure prophylaxis, PEP. And if it's over 72 hours, then what's oftentimes done is they're sent to the Peterson Clinic where workup is done on those individuals and then treated.
Okay. Thank you all for these amazing questions. If anyone else has any other questions, go ahead and reach out to us at schoolsupport@pima.gov or give us a ring. But with that being said, I hope you all have a wonderful Wednesday and a great holiday, and we will see you on January 8th at 1 p.m. Thank you so much. Have a happy holiday.